There is a medicine cabinet mistake I see again and again in older adults, and it rarely looks dangerous at first. It starts with a stiff knee, a sore back, arthritis pain in the hands, a headache that will not settle. So someone reaches for a familiar pain reliever, maybe ibuprofen, maybe naproxen, maybe another anti-inflammatory pill they have used for years without thinking twice. And because it is sold over the counter, the brain treats it as harmless. But after 60, the body does not always respond to these medicines the same way it did at 35 or 45. The arteries may be stiffer, blood pressure may already be creeping upward. The kidneys may not clear salt and fluid as efficiently. There may be plaque sitting silently inside the coronary arteries, even if the person feels completely normal. That is where the risk begins. I am Dr. Warren Hung, a medical doctor, and this is one of those topics people need explained with care, because the answer is not, never take this medicine. The real answer is, understand when this medicine becomes risky, and do not treat it like a harmless habit. If you want clear health explanations that help you ask better questions and protect your long-term health, subscribe to the channel. I keep these topics practical, serious, and easy to understand. The first medicine group that can raise concern after 60 is the family called NSAIDs. That stands for non-steroidal anti-inflammatory drugs. The common examples are ibuprofen and naproxen. Some prescription pain relievers also fall into this group. People take them because they reduce pain and inflammation. And for many people, they do help. A swollen joint feels better. A pulled muscle calms down. Arthritis becomes more manageable for a few hours. But inside the body, these medicines can do more than reduce pain. They can affect the kidneys, and the kidneys are not just urine filters. They help control blood pressure, salt balance, and fluid levels. When NSAIDs interfere with kidney blood flow, the body may hold on to more salt and water. That extra fluid can raise blood pressure. And when blood pressure rises, the heart has to pump against more resistance. Imagine trying to push water through a hose while someone is squeezing the hose from the outside. The pump has to work harder. In your body, that pump is the heart. Now add age to the picture. After 60, many people already have some degree of artery stiffness. The arteries do not stretch as easily. If there is also high blood pressure, diabetes, kidney disease, smoking history, high cholesterol, or a previous heart problem, the margin for error becomes smaller. So a medicine that felt routine can become a stress test the body did not ask for. This does not mean one tablet automatically causes a heart attack. That would be too simple, and it would scare people for the wrong reason. The concern is pattern, dose, and vulnerability. Taking a high dose for several days, taking it every week for chronic pain, mixing it with blood pressure medicine, taking it while dehydrated, taking it when kidney function is already reduced, taking it after a previous heart attack without asking the doctor. That is when the risk becomes much more serious. One of the most overlooked problems is that many people do not mention these pills during a doctor visit. They list their prescription medicines, but not the pain relievers they buy at the pharmacy. So, the doctor may be adjusting blood pressure treatment without knowing that an over-the-counter anti-inflammatory is pushing the pressure up in the background. That missing detail matters. If your blood pressure suddenly becomes harder to control, or your ankles begin swelling, or you feel more short of breath with activity, or you notice chest pressure after starting frequent pain medicine, those are not symptoms to ignore. They do not prove the medicine caused the problem, but they are enough reason to call your healthcare provider and review the full list. And please listen carefully to this part. Do not stop a prescribed medicine or replace a treatment plan because of something you hear online. The safer move is to ask direct questions. Ask, is this pain reliever safe for my heart? Ask, could it affect my blood pressure or kidneys? Ask, how many days is too many for me? Ask, is there a safer option for arthritis pain with my medical history? Ask, should I avoid this because I take blood pressure pills, blood thinners, or have kidney problems? Those questions can prevent a dangerous blind spot. The most protective habit is simple. Treat over-the-counter pain relievers as real medicines, not casual comfort pills. Keep the dose as low as your clinician recommends. Use them for the shortest reasonable time. Avoid stacking multiple products that contain similar ingredients. And make sure your doctor or pharmacist knows exactly what you are taking. Because after 60, the risk is often not one dramatic mistake. It is the quiet repetition of something that seems too ordinary to mention. And the same thing can happen with another common medicine group, especially during cold and allergy season, when people are only trying to breathe a little easier. One of the easiest medication risks to miss after 60 is not hidden in a complicated prescription bottle. It is often sitting in a cold and flu aisle. A person gets a blocked nose, sinus pressure, watery eyes, or that heavy feeling across the face. They do not think of it as a heart issue. They think, I just need something to clear my head. So they grab a decongestant, sometimes as a single ingredient, sometimes inside a multi-symptom cold medicine. And within a short time, the nose may feel clearer. But the heart and blood vessels may be feeling something very different. The medicines I am talking about are oral decongestants, especially products related to pseudoephedrine or similar ingredients used to shrink swollen blood vessels inside the nose. That shrinking effect can help open the nasal passages. But these medicines do not only speak to the blood vessels in the nose. They can also affect blood vessels elsewhere in the body. That is the part many people are never told clearly. A decongestant can tighten blood vessels. When blood vessels tighten, the space inside them becomes narrower. Blood has to move through a smaller channel. For someone young and healthy, this may cause little more than a slight jittery feeling. But after 60, especially in someone with high blood pressure, coronary artery disease, an irregular heartbeat, kidney disease, or a history of stroke, that narrowing can matter. It can raise blood pressure. It can make the heart beat faster. It can create palpitations. And in a person whose coronary arteries are already narrowed by plaque, it may increase the workload on a heart that is already operating with less room for error. This is why a medicine that feels like a simple, cold remedy can become risky in the wrong body. Think of the heart like an engine driving uphill. If the road is smooth and open, the engine can handle it. But if the road is narrow, the air is thin, and the load is heavy, the same hill becomes harder. In the body, high blood pressure, artery plaque, diabetes, smoking history, kidney problems, and age can all add load to the system. Then a decongestant comes in and tightens the blood vessels further. That does not mean every older adult who takes a cold medicine will have a heart attack, but it does mean this category deserves respect, especially when someone already has heart risk. The problem becomes even more confusing because many cold medicines combine several ingredients in one bottle or packet. One product may contain a pain reliever, a cough suppressant, a decongestant, and something for sleep. The label may say maximum strength or multi-symptom relief, but the body does not care about marketing language. The body responds to the ingredients. And after 60, those ingredients can interact with real medical conditions. If you have high blood pressure and you suddenly notice your readings climbing during a cold, do not assume it is only the illness. It could be poor sleep, dehydration, stress, fever, or pain. But it could also be the decongestant. The same applies if you notice a racing heartbeat, chest pressure, unusual shortness of breath, dizziness, or a pounding feeling in your chest. Those symptoms should not be brushed aside. Another issue is timing. People often take these medicines when they are already run down. They may not be drinking enough. They may be sleeping poorly. They may have a fever. They may be taking an anti-inflammatory pain reliever at the same time for body aches. So the heart is not dealing with one stressor. It is dealing with several. That is how risk stacks up quietly. A person might say, but I only took it for a few days. Sometimes, a few days is not the problem. But for someone with unstable blood pressure, heart rhythm problems, recent chest pain, or known coronary disease, even a short period can be enough to trigger concern. The safer habit is to slow down before choosing the strongest product on the shelf. Read the active ingredients. Ask the pharmacist whether the product is safe with your blood pressure, heart history, and current medicines. If you already have hypertension or heart disease, ask whether a non-oral option, saline spray, humidification, hydration, or another approach may be safer for you. Sometimes the best choice is not the strongest medicine. It is the one that treats the symptom without pushing the heart. And if a clinician has told you to avoid decongestants, take that seriously. That advice is not random. It usually means your cardiovascular system has less flexibility than someone else's. This is also a good place to ask you something. Have you ever bought a cold medicine and only later realized it had ingredients you did not expect? If so, you are not alone. These combination products confuse many people, and that confusion is exactly why older adults need to be more careful with them. The goal is not to suffer through every cold with no help. The goal is to choose relief that matches your body. Because after 60, the question is not just, will this clear my nose? The better question is, what else will this medicine do while it clears my nose? And once you begin thinking that way, another old habit deserves a much closer look, especially a tiny pill. Many people started years ago because they believed it was protecting their heart. For years, many adults were taught a simple idea. Take a small aspirin every day, and you may lower your chance of having a heart attack. That message was repeated so often that some people began treating aspirin like a daily vitamin. They added it to their morning routine. They kept it next to the coffee. They packed it with their blood pressure pills. And after a while, they forgot the most important question. Why am I taking this? That question matters a great deal after 60. Aspirin is not a harmless supplement. It is a real medicine that changes how blood platelets behave. Platelets are tiny blood cells that help form clots. When you cut yourself, platelets help stop bleeding. But inside an artery, a clot can become dangerous if it blocks blood flow to the heart or brain. That is why aspirin can be helpful for certain people. If someone has already had a heart attack, a stroke, a stent, bypass surgery, or certain forms of known cardiovascular disease, aspirin may be part of a carefully chosen plan. In that situation, the goal is often to reduce the chance of another clot-related event. But that is very different from starting aspirin just because someone is older. This is where many people get misled. There are two different situations. The first is called secondary prevention. That means a person already had a serious heart or blood vessel event, and the goal is to prevent another one. In plain English, the body has already shown that clotting inside the arteries is a real threat. The second is called primary prevention. That means a person has not had a heart attack, stroke, stent, or similar event, but they are taking aspirin, hoping to prevent a first one. Those two situations are not the same. After 60, starting daily aspirin for primary prevention can become a problem, because the bleeding risk rises with age. Aspirin makes clotting less active. That may sound helpful when thinking about heart attacks, but the body also needs clotting to prevent dangerous bleeding. The risk may include bleeding in the stomach, intestines, or even the brain. So the question becomes balance. Is the possible heart benefit greater than the bleeding danger? For many adults over 60 who have never had a heart attack or stroke, that balance may not favor starting aspirin. That is why medical guidance has changed over time. The older advice was broad. The newer thinking is more careful. It asks, who is the person? What is their history? What is their bleeding risk? And what problem are we trying to prevent? This is very important. If your doctor prescribed aspirin because of a heart attack, stent, stroke, bypass surgery, or another clear cardiovascular reason, do not stop it on your own. Stopping suddenly may be dangerous for some people. The point is not to fear aspirin. The point is to understand why you take it. The dangerous habit is taking it for years, with no clear reason, no review, and no conversation. Some people began aspirin because a friend recommended it. Some started because they heard it was good for the heart. Some were told decades ago and never revisited the decision. Some take it along with other medicines that increase bleeding risk, such as blood thinners, certain anti-inflammatory pain relievers, or steroids. That combination can change the risk quickly. Let's make this practical. If you are over 60 and take aspirin every day, ask your clinician a very direct question. Am I taking this for primary prevention or secondary prevention? That one question can clarify the entire conversation. If the answer is secondary prevention, the next question is, what is the safest way for me to take it and what bleeding signs should I watch for? If the answer is primary prevention, ask, do my current risks still justify this, or should we review it? Bleeding warning signs can include black or tar-like stools, vomiting blood or material that looks like coffee grounds, unusual bruising, sudden severe headache, weakness on one side of the body, confusion, or unexplained dizziness. Those symptoms need urgent medical attention. But there are quieter signs too. Fatigue from slow blood loss, lightheadedness, shortness of breath that seems new, a drop in blood count on routine labs. These are the kinds of clues people may miss because they do not connect them to a tiny daily pill. Aspirin also becomes more complicated when mixed with the pain medicines we already talked about. Many NSAIDs can irritate the stomach lining. Aspirin can reduce clotting. Together, in some people, that can raise bleeding risk. And if someone also has high blood pressure, kidney disease, or a history of ulcers, the situation deserves even more caution. This is why medication review after 60 is not just paperwork. It can prevent real harm. Bring every pill to the appointment, prescription medicine, over-the-counter medicine, supplements, pain relievers, cold medicines, aspirin, everything. Do not assume your doctor already knows. The safest medication plan is built from the full picture, not from half the list. The lesson with aspirin is simple but powerful. A medicine can be protective in one person and unnecessary or risky in another. The difference is not the pill. The difference is the reason, the history, and the risk profile of the person taking it. And once you understand that, another category becomes easier to see clearly. Medicines that may be necessary for inflammation, breathing, pain, or hormone levels, but can quietly push blood pressure, fluid balance, and heart strain in the wrong direction. Some medicines are powerful because they can calm the body quickly. That is why they are prescribed. A bad asthma flare, a severe allergic reaction, a painful inflammatory condition, a swollen joint, a skin disease that suddenly becomes difficult to control. In the right situation, these medicines can be very useful, and sometimes they are necessary. But after 60, there is a difference between using a powerful medicine carefully and using it again and again without reviewing what it is doing to the rest of the body. One of the biggest examples is oral corticosteroids, such as prednisone. Prednisone is not the same as the steroids used illegally for muscle building. It is a medication doctors use to reduce inflammation. It can make breathing easier during certain flares. It can calm severe inflammation. It can reduce swelling and pain. For many conditions, it has an important place. But the body does not experience prednisone as a small thing. Corticosteroids can raise blood pressure. They can increase fluid retention. They can raise blood sugar. They can affect sleep. They can change appetite and weight. They can make the body hold more salt. And when those effects happen in an older adult who already has high blood pressure, diabetes, kidney disease, heart failure, or coronary artery disease, the heart may feel the pressure. Again, the danger is not always one short course. Sometimes a short course is the right medical decision. The danger often comes from repeated courses, higher doses, long-term use, or using the medicine without enough monitoring. Think about what happens when blood pressure rises and the body holds fluid. The heart has to push against more force. The blood vessels carry more pressure. The kidneys may have to manage more fluid and salt. The legs may swell. Breathing may feel heavier. Blood sugar may climb, which can irritate blood vessels over time. For someone with plaque in the coronary arteries, this extra strain can reduce the safety margin. That is why a person may say, "I only took it for inflammation, but the heart may still be affected." This does not mean prednisone is a bad medicine. It means it is a serious medicine, and serious medicines deserve serious follow-up. If you are prescribed corticosteroids after 60, ask how long you should take them, whether the dose can be reduced when safe, whether you need blood pressure checks, whether your blood sugar should be monitored, and what warning signs should lead you to call the doctor. Those warning signs may include sudden swelling in the legs, new shortness of breath, rapid weight gain over a few days, chest pressure, very high blood pressure readings, confusion, severe weakness, or blood sugar that becomes difficult to control. And please be careful with leftover pills. Some people keep prednisone from an old prescription and restart it when pain or breathing symptoms return. That can be dangerous. The same symptom can have a different cause the second time, and the dose that seemed to help once may not be safe with new medications or new health problems. There's another medicine category that deserves the same careful thinking: hormone-related treatment, especially testosterone products. Testosterone therapy can be appropriate for some men with confirmed low testosterone and symptoms after proper testing and medical evaluation, but it should not be treated like a casual, anti-aging shortcut. After 60, the heart and blood vessels need careful respect. Testosterone products can affect red blood cell levels, fluid balance, blood pressure, and other cardiovascular markers. In some people, they may worsen untreated sleep apnea, raise hematocrit, or contribute to higher blood pressure. Hematocrit means the percentage of blood made up of red blood cells. If it gets too high, blood can become thicker, and thicker blood is harder to move smoothly through the circulation. That is one reason monitoring matters. A man may feel more energy at first and assume the treatment is only helping, but a treatment can improve one symptom while creating another risk in the background. That is why proper follow-up may include blood pressure checks, blood tests, symptom review, and a clear reason for continuing. This is especially important for men with a history of heart disease, stroke, uncontrolled high blood pressure, clotting problems, severe sleep apnea, or unexplained chest symptoms. Those situations need direct medical supervision, not guesswork. The same principle applies to any hormone-like medication or strong inflammation medicine. The question is not only, does it make me feel better? The better question is, what is it doing to my blood pressure, blood sugar, fluid balance, clotting risk, and heart workload? That is the question many people never ask. And after 60, the body may give quieter warnings. A little more ankle swelling, a few higher blood pressure readings, more breathlessness climbing stairs, a pounding heartbeat at night, a blood sugar number that suddenly looks worse. These can seem unrelated, but they may be signs that the medication plan needs review. So if you use steroids repeatedly, or if you are considering testosterone treatment, do not approach it casually. Ask what problem is being treated. Ask how long the medicine is needed. Ask what should be monitored. Ask what side effects should make you call. Ask whether there are safer, long-term options for the condition being treated. That conversation is not about refusing treatment, it is about making treatment safer. Because the strongest medicines often help the most when they are used with the clearest plan. And when that plan is missing, the heart may be left carrying the cost before anyone connects the dots. The final medicine group is one many people do not connect with the heart at all. Antibiotics. When someone hears the word antibiotic, they usually think of infection, a chest infection, a sinus infection, a urinary infection, a skin infection. The question in their mind is usually simple. Will this kill the bacteria and help me recover? That is a reasonable question. But after 60, there is another question that sometimes matters just as much. Is this antibiotic safe for my heart rhythm, my other medicines, and my current health conditions? Some antibiotics can affect the electrical timing of the heart. The heart is not just a muscle pump, it is also an electrical organ. Each beat depends on tiny electrical signals moving in an organized pattern. When that timing is disrupted, the heart may beat irregularly, too fast, or in rare cases, dangerously out of rhythm. One term you may hear is QT interval. That is a measurement on an electrocardiogram, or ECG. In plain language, it reflects part of the heart's electrical reset time between beats. If the QT interval becomes too long, some people become more vulnerable to dangerous rhythm problems. This does not mean every antibiotic causes this. It does not mean you should refuse antibiotics when you need them. Untreated infection can also place major stress on the heart, especially in older adults. Fever, dehydration, inflammation, and low oxygen can all increase heart workload. So the goal is not fear. The goal is the right antibiotic for the right person. One antibiotic that has received attention is azithromycin. It is commonly used for certain respiratory and other infections. For many people, it may be appropriate. But in some patients, especially those with existing heart rhythm problems, low potassium or magnesium, slow heart rate, certain heart diseases, or other medicines that also affect QT interval, the risk needs careful thought. And azithromycin is not the only medicine where this issue can arise. Some other antibiotic families and certain antifungal or nausea medicines can also affect heart rhythm in vulnerable people. The bigger lesson is that the heart's electrical system can be influenced by medication combinations, not just one prescription in isolation. This is where older adults are especially vulnerable. After 60, many people are already taking several medicines. A blood pressure pill, a diabetes medicine, a cholesterol medicine, a water pill, a blood thinner, something for sleep, something for stomach acid, maybe an antidepressant, maybe an anti-nausea medicine, maybe an inhaler or steroid during an illness. Each medicine may have a reason, but when a new antibiotic is added, the full combination matters. One of the most common hidden risks is electrolyte imbalance. Electrolytes are minerals in the blood, such as potassium and magnesium, that help the heart's electrical system work properly. If potassium or magnesium is low, the heart may become more sensitive to rhythm problems. Why would those minerals be low? A water pill can lower potassium. Vomiting or diarrhea can lower potassium and magnesium. Poor eating during illness can contribute. Kidney problems can make levels harder to predict. Some people are already dehydrated when they start antibiotics because they have been sick for several days. So a person may think the antibiotic is the only new factor, but the real risk is the whole situation: infection, dehydration, low electrolytes, existing heart disease, and other medicines. That is why symptoms matter. If you start a new antibiotic and develop fainting, near fainting, strong palpitations, sudden chest pressure, severe dizziness, unusual shortness of breath, or a feeling that your heartbeat is racing or skipping in a way that feels new, get medical help promptly. Those symptoms do not prove a dangerous rhythm, but they are not symptoms to ignore. And if you already have a known rhythm condition, a pacemaker, heart failure, prior heart attack, long QT syndrome, kidney disease, or you take several prescriptions, tell the prescriber before starting a new antibiotic. Do not assume your full history is visible in every clinic, urgent care, or pharmacy record. The safer habit is simple. When an antibiotic is prescribed, ask, does this interact with any of my heart medicines? Ask, does this affect heart rhythm? Ask, do I need to worry about potassium or magnesium? Ask, is there another option that fits my heart history better? Those questions are not difficult, but they can change the choice. Now, let's bring all 5 categories together. The pain reliever that raises blood pressure, the decongestant that tightens blood vessels, the aspirin habit that may no longer match the reason it was started, the steroid or hormone medicine that can increase fluid, pressure, blood sugar, or blood thickness, the antibiotic that can disturb electrical rhythm in vulnerable people. The common thread is not that these medicines are always bad. The common thread is that after 60, the body has less room for silent stress. Arteries are often stiffer. Plaque may be present without symptoms. Kidney function may be lower than it used to be. Blood pressure may swing more easily. The heart's electrical system may be more sensitive. And several medications may be interacting at the same time. That is why the most protective step is not panic. It is a medication review. Make a complete list. Include prescriptions, over-the-counter pills, pain relievers, cold medicines, supplements, vitamins, patches, creams, and anything taken only once in a while. Bring that list to your doctor or pharmacist. Ask which medicines affect blood pressure, bleeding, kidney function, fluid retention, blood sugar, clotting, or heart rhythm. And do not forget the simple question that catches many problems early. Do I still need this? Many medication risks continue because nobody revisits the reason the medicine was started. The prescription gets renewed. The over-the-counter pill becomes habit. The cold medicine gets bought again. The aspirin stays on the counter because it has always been there. But your body at 60, 70, or 80 is not the same body that started the medicine years ago. That does not mean you should stop medicines on your own. It means your medication plan should age with you. If this helped you think differently about heart risk after 60, subscribe to the channel for more clear, practical health explanations with Dr. Warren Hung. And if you take more than 3 medicines, or you regularly use pain relievers or cold medicines, consider asking your pharmacist or doctor for a medication safety review. It may be one of the simplest conversations that protects your heart before trouble has a chance to announce itself.